This is Dr. Yates here in Chicago. Today we're going to talk about FUE and SMP. SMP, scalp micropigmentation. Some people say scalp tattooing. I say no, it's not. It's just, it's like the old, what the doll's hair is to the new FUE. We don't use any tattoo ink. It's medical pigment. It's all natural. Doesn't turn purple, doesn't turn blue, and it looks perfect. So what we want to do is we create a look that looks just like a buzz cut. Because a lot of times people want to wear their hair short, but they don't have enough donor hair to do the transplants to get the density, so we do SMP. So here's my friend Roland, who's also my patient. He has a good aesthetic eye, which is very important. He's also an artist, he's a barber as well. So Roland, before we start talking, I just want to show a picture. This is what Roland came to us looking like, something like that, which, you know, is a nice looking fella, but right now I think he looks better. Roland, what do you think about this?
Yeah, it looks phenomenal. Much big difference.
This looks phenomenal? Or
no, this. Well, you know, this used to go way back farther. So now coming in with more of a line and a upfront look of hair, it's a big deal.
It's a big deal. And that's why I think a combination between SMP and FUE kind of answers the question where everybody wants a great haircut, but they want to have that look, you know, short hair, but, you know, want to have a transplant as well. So, Roland, what do you think about what we've done here? You know, as far as naturalness, what have your friends said?
Honestly, well, the certain needles that you guys use a 3, 2, and a 1. 1 being more thin, which is the natural look. And there's been a time, maybe 5, 10 years ago, that I thought I'd never have this look again. So, that's a big deal.
It's a big deal.
That's a big deal.
And what he could also do, if you turn around a little bit, he has so much donor hair here. And we've just SMP'd Roland. We could take some of this donor hair, move it up here to give it more texture or a 3D, kind of that third dimension instead of just in 1 or 2 dimensions here as we have with his hair now. I mean, he doesn't need to do that because he has a perfect look. The other thing it does with FUE, we can bring people's hairline down further because all these equations about how many grafts we need and running out of grafts is not going to happen because with SMP we create the density we need. Like, Roland, what would you say? Like, would you recommend this to your friends? Did it hurt?
Yeah, definitely. They probably might be skeptical at first because they don't understand the procedure. But once you got the knowledge and you start understanding it, and then you get this result, who's going to say no? I mean, you shouldn't. I mean, I wouldn't.
I mean, like my grandmother said, the proof's in the pudding.
Right.
So this is Dr. Yates here in Chicago. This is Roland. He has a great result. I love it. And we'll see you soon.
3 minutes.
I want to keep going.